So hello again, Ebony. Yeah, it's good to see you again and hear from you. And I know you wanted to be able to have a chance to just chat about where we left off from. I know you were expecting to have a visit with the genetic counselor. So
It was not what I expected, actually. I know I should have saw like in the title, genetic counseling, it'd be more talking, but I guess I was expecting like actual like blood work or
Mhm.
examination or something like to
Mhm.
that effect. But
How long
no,
of a visit was it? Like a 30-minute type of visit, in and out?
yeah, because yeah, I want to say probably a little bit longer because we were doing with that family history and they're asking a
Mhm.
lot of questions. So it was a little bit more like lengthy, but
Okay.
it was more so because we were talking.
Okay. And so they asked probably a lot. If I remember back to when I had this done, it was like, who's mom, who's dad, what was there, what
Yeah.
illnesses do you know that they have, didn't have, that type of
Yes.
thing. Yeah. And do they go back as far as like grandparents, siblings?
Yeah, so they did go back as far as that they want to get both sides, mom, dad side, siblings, their kids, so like my nieces, nephews, all that,
Oh,
which
okay.
I
Yep.
was able to give them a decent amount. My father's side is more a little bit more difficult for me because I'm not as close with that side. But yeah,
But
we
what
were
you
doing
did know,
this.
you were able to share.
Yes.
So what kind of feedback did you get?
Not a lot of feedback, to be honest. It wasn't a lot at all. It was just more so you don't have any symptoms, like your family, you don't know what side of the family it came from. So maybe it might be worth it to have them get tested to see what side, if it's mom or dad's side of the family.
Mm-hmm. Did they
Mm.
plan to see you again, this genetic counselor?
No, they didn't.
It
They
was that was the information, and that's that.
that was, yeah, that was the information. That was it.
I can't remember if you mentioned to me, but out of curiosity, do you know if the genetic counselor was familiar with hereditary amyloidosis at all, or is this just like a basic genetics counselor
No, it seems like it was just like a basic genetic counselor.
on the referral system
Yeah.
from PCP? Have you been able to talk to your primary care again about this visit?
No, so my plan is so they did I had to ask for it. They did refer me back to the cardiologist that I had met with a couple years ago.
Okay.
That's to do the echocardiogram again. They'll probably do blood work again, but I had to ask for that.
Okay.
It
So
wasn't.
is it like an automatic, oh yeah, you should probably have this followed up with an amyloidosis center on the part of the genetics counselor, or really the PCP is just going to move it along?
Yeah, no. So my plan is to meet with the PCP after
I see.
I meet with the cardiologist, make an appointment because I usually see my PCP like every 4 months anyway.
I see.
And I missed the last appointment because I was sick. So I plan to after this appointment with the cardiologist, which is actually Tuesday.
Okay.
Next week it's Tuesday.
Oh,
I'll
great.
follow up with her.
With and see what they say in terms of what you should do at this point, because you are relatively young and asymptomatic. And you know what I found, because I know I've chatted with you about my personal story, and the difference between you and I is I do know that I had a father with the illness, is that it seems, at least across the United States, a lot of the centers and providers have a different system for how they evaluate or observe people like us. Interestingly enough, I am on an annual schedule, and my I also have to be seen in March at my center as well for my third annual follow up. So I think the thing for you possibly to find out, or what you think about, or what you like to have, is do we want to start an observation period, especially since you're maybe not sure of all of your family history?
Yeah, I think that would be worth it. From what I understand, you want to get ahead of any possible like severe complications from this
Mhm.
disease. If I can be observed, and let's say I do have symptoms that I'm just not even aware of, at
Mhm.
least then we can start any treatments and get ahead of any type of damage that could be caused.
Exactly. And the commonality normally in V122I, from what is understood, it is a disease that typically occurs as you enter mid to later in life. I'm, for instance, am 40, nearly 49 years old. They estimated my father to probably be in his 50s when he started with illness. Again, this is an estimate because he came to them pretty with cardiomyopathy because he
Yeah.
didn't have the history of knowing that he was a carrier for this. So the idea with some centers is to try to start seeing people at least 10 years, 10 or so years before the predicted age of onset. Like in my case, it would be probably like 43 to the age I am right now. So that way they can start an observation period. The thing that is probably a little bit different with you is where to start, but that doesn't
Yeah.
mean that shouldn't happen, because you're absolutely right. It would be like, okay, even if this might not occur, or it may not occur to me at all, or it might not occur to later, I would better off knowing that I should be looked at this point, so that if I do start having cardiac symptoms or anything like that, it's at the beginning rather than severe illness.
Yeah.
Absolutely. So it sounds like you might have been a little bit frustrated.
Yeah, like, even some of the questions I had about, like, the specific variant, they didn't really it was more so they were just like, "Oh, that's not really that important." But I'm like, I feel like it is because with certain variants, you might have certain different symptoms. It
Mm,
might affect other parts of your body more severely. So, no, they didn't even have really much to offer me in terms of that variant, what
mhm.
to expect with that, with people who do end up having
Our
symptoms down the
symptoms.
line.
Yes, I know, because the other problem to Ebony with this particular variant is what they call penetrance. So, meaning it's variable in how it penetrates. So, it could be a complete penetrance and act a disease with full symptoms, and it could be incomplete and look completely something different. And I think, like last time we talked, that's why the research aspect is so important, because more data needs to be around surrounding this to see what it looks like in people like you and I, and what if we looked at this at you at your age and my age, and what ended up happening 20 or so years later. I know I was told last year in one of my appointments, if you remember, I said to you that I am treated now, even though
Mhm.
I have an inconclusive diagnosis, is because they said they don't really know yet. They don't have enough research on what it looks like in the soft tissues. So even if I'm testing negative for certain things, it could be their testing, what they have diagnostically, is not sensitive enough yet to pick up the earliest of symptoms. So that's where I think us getting the information out there about the disease and people interested in the research is so key,
Mhm.
because they can start to see and say, oh, you know what, we really should be treating this at this point rather than waiting until 50s or other. But unfortunately, they're not there yet. And then I think you're also illustrating where, even with you going through the healthcare system, there are limitations in how people understand that particular mutation or variant works. So
Mhm.
ideally, what would you have liked to see happen once you got this information from your primary care?
I would have liked to have I would have liked that they just said, "You know what? We don't know I don't know specifically enough about this disease. Let me refer you to someone who does." Or even if I don't know someone who doesn't, like, let me do a little research to see, like, where if it's I have to go outside of this hospital, where you can go and get this help.
So
Because
you
I
felt like you probably had to push the issue a little bit for them to say, okay, we're going to refer you back to the cardiologist you saw before. And that if somebody in your situation hadn't necessarily self advocated in that way, it might have fallen flat for another few years. Because I know you had said to me before, it had been in your chart for 3.5 years. And then had you not had the presence of mind, and kudos to you for doing that, to say I should probably examine this more and self advocate, it could have sat even longer, because you just said, okay, they're telling me I don't need to worry about it. So it sounds like there's just so I like to look at things as it's just a challenge or something, identifying the gaps so we can like fix the gaps, rather than that's my hope, at least in
yeah.
my patient hat and also in my professional hat, to be like, okay, here's where we had a little bit of a system breakdown, and how can we improve that for the next stage and make it better for the patient. Because I agree with you. Ideally, I think once your PCP said, which was great, that she was like, oh no, I don't like this result, that
Mhm.
she could have referred you to an amyloidosis center or somebody that was familiar with testing related to amyloidosis. And then
Mhm.
even if not, that wasn't available to you, that the genetics counselor was like, oh, as you say, I don't know enough about this, but I'm going to be in touch with my colleagues or do some reading and figure out how we should go from here.
Yeah, exactly. And it just speaks to like with the healthcare system, is it that we don't pay enough attention when people are asymptomatic or when
Mhm.
they're not really all that acute. It's like someone have to be acute before we start
We address
really
it.
addressing the situation. But
Mhm.
by then, sometimes it's too late. The damage has been done.
Exactly, and now that we have when you I've talked to you about my father, and at the time, the medications, they weren't there. The research wasn't there to give them the approved medications to help him much. But now that we're in this space where there's a lot of therapies, both in the research setting and in the approved setting, that could actually help people, and it is being proven that the earlier you start that type of treatment, the better off your outcome. It is so important to, like you said, to look at that asymptomatic patient or the one that is presenting as asymptomatic, but maybe they do have a little bit of something going on. Like if you lose my instance, it's, oh, my fingers feel numb, like my foot feels numb, but I don't necessarily have a peripheral neuropathy. Yeah. But oh,
Yeah.
maybe we should keep an eye on that because maybe she will develop that. And we want to start doing something more what we can to help her. And the same for you. But again, it takes people having the knowledge. I think that they should
Mhm.
even be looking and understanding of what hereditary amyloidosis is
Yeah.
and how it could potentially present. So, how are you feeling about your upcoming appointment with the cardiologist?
I don't know. I guess I'm more so, I guess with this last appointment, I was disappointed because I thought I
Mhm,
would get more, and
mhm,
it makes me feel like, am I walking into a situation where it's going to be the same thing where
mhm,
he looks at me, examines me,
mhm.
hopefully he does some testing, maybe find that there's nothing there and say, "Oh, okay, you're fine. Come back
Are you
in
going to
3
get more?
years."
Yeah, are
Yeah.
you going to get more disappointed than you already are? Are you feeling like you're going to be able to be proactive
Yeah.
about something? I think I know that we've talked about a little bit before about the research aspects and about also we were talking about how different centers have different philosophies on observing people like you. But my advice to you would definitely be saying if you don't want to do an annual type of observation or assuming you test negative for everything when you do go for this appointment, what research is out there for people like myself who are carriers and asymptomatic because there is research, Ebony. And the
Mhm.
more that and I think if you get tied into the healthcare system in that way with research, then it's been my experience, even in looking at other disease indications, the healthcare community is just more aware of you
Yeah.
because you're seen more regularly. And therefore, you'll probably triaged a little bit quicker if something were to happen. That would be
Mhm.
my advice. And I actually have this kind of great diagnosis, and I still want to be able to participate in the research aspects of it just because I think it is so important. And if I have the opportunity to do something that's going to improve my outcome and the future of my family, I want to be able to do it. And I'm
Yeah.
sorry, I want to say I'm sorry that that has left you feeling a little bit disappointed, but I thank you for actually being able to state that too, because I think my dad used to say, if we don't identify the problems, then we can't fix them. So
Yeah.
I think part of you and
Absolutely.
I doing this is saying, oh, this is what's positive. This is what happened. That's great. This is what was like, could have gone better. And the whole aim is to get folks seen and taken care of earlier.
Yeah. But I'm gonna continue to advocate for myself until I feel like, okay, I'm getting the response that I want, like I'm being taken seriously. I'll continue to
I
advocate
think
for
that was
myself.
your advice
Yeah.
that you would give to other folks that are in your situation.
Yes,
Would be
absolutely.
it's okay to speak up.
Yes, absolutely. Because it's just your health, your body. You have
Mhm.
one. You have to.
Exactly. And it's okay to continue to ask questions until you have answers or you feel comfortable with what the course or the direction that things are going. I know even in my own journey, I remember with PCP that I had a struggle with, they actually said to me, good thing you advocated for yourself. And so I think that is a very strong and important message. I'm glad that you're doing it.
Yes, me too. I hope everyone, and I know it's not easy for all people to advocate for themselves
And
in
I think a
any
lot of,
instance.
yeah, you're
Yeah.
right. I think some of that has to do with you're already in a situation where you're nervous being about your health, and then you're assumed. that the medical professional, a lot of times they say, okay, the medical profession, they're smarter than me, so they know. And I have a few friends, but a friend in the medical profession has said, Aaron, that just means I went to school longer and for a specific thing.
Yeah.
Know your own body. And it's
Nobody.
our
Yeah.
responsibility to listen to what you're saying about your
Yeah.
body and your health.
Absolutely.
All right, Ebony.
Yeah.
So I guess we'll chat again after your next appointment next week. See how that goes and how you're feeling. And I'm hoping you're gonna feel less disappointed and you have a
Yes.
better direction for where you should go at this point.
Yes. I'm looking forward to it.